There's a beautiful quote which very aptly describes the importance of good health. He who has health has hope, and he who has hope has everything. By Thomas Carlyle. Good evening, everyone. This is Surekha Chidambarnath from Pillai College of Education and Research. I'll be the host today. So, good health is essential to human happiness and well being that contributes significantly to prosperity and wealth and even economic progress, as healthy people are more productive, save more, and live longer. Good oral hygiene is directly related to good health. It has been said that the mouth is the gateway to your overall health. Not properly taking care of your teeth and gums can lead to a variety of health problems. From loss of teeth and gum disease to heart disease and diabetes, oral health is very important. Because don't forget, behind every smile, there is teeth. To highlight the benefits of good health, spread awareness about oral diseases, and also promote maintenance of oral hygiene, in 2013, the FDI World Dental Federation launched World Health Day on March 20. Every year, the World Dental Federation announces a theme, and the campaign theme for Oral Health Day from 2021 to 2023 is Be Proud of Your Mouth. The UN is asking people to take meaningful action and end the neglect of global oral health. The organization is encouraging as many people as possible to look after their mouth and protect their quality of life. An unhealthy mouth not only impacts general health but also has severe impact on people's emotional, social, mental, and overall physical well being. But what we know about oral health is very little. So, to enlighten our participants on the significance of good oral health, we have invited an expert, Dr. Angela Edwin. Dr. Angela Edwin has been helping people to put their best smile forward for the past 5 years. She has completed her dental degree from Sri Yashwantrao Chavan Dental College, Ahmednagar, Maharashtra, and has done her internship from GD Pole's Yerla Dental College, Kharghar, Navi, Mumbai. Her desire to enter the field ignited when she was in her fourth grade, and she strongly believes that healthy oral hygiene habits must start early on and emphasizes this point to her patients and their families. She has also done a research on the topic temporomandibular joint disorders. She has attended various seminars and participated in scientific poster presentations. She has also attained a specialty in the field of rotary endon, endodontics and has recently started her own private dental clinic in Ulwe, Navi, Mumbai. We welcome Dr. Angela to our show. Pillai College of Education and Research is proud of your gracious presence, and we look forward to a valuable and informative session. Over to you, Dr. Angela.
Thank you so much, Sureka, for an amazing introduction. I would also like to take this opportunity to Pillai College of Education and Research to invite me to speak on this very important topic, which is oral health care and how to maintain it. So, without further ado, I would like to proceed with my presentation. So today, 20th March, as we know, is World Oral Health Day. The theme of these years, what 2-3 years we have from 2021 to 2023, is be proud of your mouth. It simply means about not having a perfect mouth, but instead having a healthy one. People should value and take care of their oral health and make right decisions to perfect it. So, the topic that I'm going to be speaking on is basics of oral health and dental hygiene. There are subtopics which I'll be discussing, like what is oral health, what is the importance of oral health, What are dental cavities and how should we detect them so that we are aware that we have a dental cavity in our mouth? The risk factors and the symptoms of beginning of a decay or a cavity. There are certain myths and certain facts which I want to clear about dental care. Bad dental habits and their impact on our oral health, the correct way to brush our teeth, what is bad breath, the causes, how to prevent it, and the treatment. What is tooth sensitivity? What causes tooth sensitivity, the prevention and the treatment. The alarming signs when you have to go and visit your dentist right away. And at last, I'll be telling few dental facts. So, what is oral health? Oral health refers to health of not only teeth but also of the gums and entire oral facial system that allows us to smile, speak, and chew. So, it is a combination of all these things, right? Some of the most common diseases that impact oral health includes cavities, gum diseases, and oral cancer. Oral health actually acts as a mirror to your overall health. Importance of oral health. Good oral health is important because it prevents many diseases and disorders from developing in the mouth. Your mouth is a window to your overall health. It acts as an entry point into our digestive and respiratory tract. Mouth is the first place where you see any symptoms of many illnesses, be it diabetes, oral cancer, autoimmune disorders, anemia, hematological disorders, or endocrine disorders. So, what are dental cavities? So, usually what we see is some black pit which is formed. You know, they are the permanently damaged areas in the hard surfaces of your teeth. They are caused by combination of factors. So it can be because of bacteria which are accumulated in your mouth. It can be if you're sipping too many of sugary drinks. It can be if you are having frequent snacking in between. If there's also decreased salivary flow. So what happens is when you have decreased salivary flow, the saliva acts as a natural buffer in your inside your mouth to keep the acidity in control. But if the salivary flow is less, so you have dry mouth and then the cavities start forming. And obviously, if you're not cleaning your teeth well, you will get a dental cavity. So, what are the stages of tooth decay? Now we have noticed we have a dental cavity. So, first, what you will see is there is a white spot. So, coming before the white spot, also, if you don't clean your teeth well, there are bacteria formed in your overall beneath your teeth or in the gum layer. And if you see, there's a thin layer of plaque which is formed. Okay, after 14 days the plaque, it gets mineralized and forms more thicker containing bacteria which is called as tartar or calculus. So at this stage you will see that a white spot, that's the first sign. You'll see the white spot is come in any place of your tooth. Later, this white spot, if it is not cleaned properly and if not taken care of, it will go ahead and reach to the enamel layer. So your tooth consists basically of three layers. It has enamel, which is the hardest. There is a dentinal layer, the second layer, where there is sensitivity caused. And the third, which is a pulp layer, where there is involvement of your nerves and blood vessels. So now that the white spot lesion is there, right? So it will go forward and go to the first layer, that is your enamel layer. That time you can definitely go visit your doctor and then the doctor will suggest you for a filling. If it progresses further, which is to a dentinal cavity, which is the second layer, over there the patient will start experiencing a sensitivity. Okay, at this stage also you can get a filling done, but if you ignore it, it will develop further, go to the third layer, which is the pulpal layer, and it has the blood vessels and the nerves involved. At this stage, you cannot do a filling. You may be advised for a root canal treatment. So, what are the risk factors? It depends on the location of the tooth. There are certain tooth positions or locations rather, which are difficult to access. So, because of that, you may have a cavity. The type of food and drinks that we have. If there are acidic drinks like Pepsi, Coke, or any of that sort, if you're having food, not only sugary, but also starchy foods and carbohydrates, can also have a risk factor. Because of frequent snacking, when you're continuously snacking in between and not rinsing, there's a risk. Bedtime infant feeding. Bedtime infant feeding, okay, so this is when you give a bottle to a baby to drink and they are continuously drinking it full night. So that's called as a bedtime infant feeding. Inadequate brushing. If you're not brushing properly, there is a risk factor. Dry mouth, like I explained earlier, dry mouth because of less of saliva, which doesn't protect, and then you have a risk for a cavity. And GERD, acid reflux. That's mostly in the acidity, those who have acidity issue. The food keeps coming on top in the mouth and it gets accumulated. So that's also one of the reason for the decay. What are the symptoms? How do you understand you have a decay? Pain when you bite something, sensitivity, pain on eating and drinking cold or hot, visible holes and pit on your tooth, or toothache. There are innumerable myths about dental care and hygiene. I've listed down few of the myths which I want to bust, and I will tell you what exactly is the fact. Starting with the first one, brushing harder means cleaning better. Many of the people feel that if you brush harder means you're cleaning perfectly, but that is not true at all. If you're brushing harder, it means that you are causing injury to your tooth and also the gum underlying soft tissue which is present. So I would really advise to use a soft or a ultra soft toothbrush to clean, and don't clean it very hardly but with a normal pressure. Milk or baby teeth don't need good oral health care since they are going to fall off anyway. So I see many parents coming up and showing their kids' teeth for checkup, and then they would be like, this teeth is anyways going to fall, so I don't need to take care of them. But this is absolutely not true. The kids' teeth, that is the milk teeth, also have a thin layer of enamel, which also can cause cavities. And secondly, that if the milk teeth are not taken care of, there are high chances that your adult teeth also come abnormally. So we have to take care of the milk teeth as well. Charcoal toothpaste is better than regular toothpaste. Nowadays, you must be seeing a lot of advertisement showing that charcoal toothpaste give you more cleaner and whiter teeth. But sorry to break it out to you, but this charcoal toothpaste is only going to harm your teeth in the way that it rubs off your enamel, which is the first layer, like I told you. It will rub off the enamel with time. So it's better you use a regular or normal toothpaste, a fluoridated toothpaste which has a fluoride content, and brush your teeth. Toothbrushes should be changed only when they show signs of fraying. This is partially true, I would say. Definitely, when you see signs of fraying, you have to change it, but it is not completely. You have to also change it every 3 months, whether they're afraid or not afraid. And now, recently, we have a research done, and it has been found out that if you have undergone any serious illness like maybe COVID or respiratory trouble or a flu, change your brush immediately. Wisdom tooth serves no purpose and always need to be extracted. So wisdom tooth is not always needed to be extraction. If they are decayed and causing trouble, definitely yes. But if they are in a proper position and if they can be salvaged, they are very good to be used and not need to be removed. Anthropologists also believe that the wisdom tooth was basically it was being there because we were having in the older times we used to have rough and coarse food like meat and all of that, but now with time, with years, the processed food, and we don't have much stress to eat with the last tooth, which is the wisdom tooth. So, with time, evolutionarily, it may be functionless tooth, but not necessarily to be removed at all. Pregnant women don't need to pay attention to oral health and avoid dental visit. This is not true, as during pregnancy, you should take utmost care of your oral health and always visit the dentist as a usual regular checkup. If you want to get any your dental treatment done, it is advisable that you get it done in the second trimester, that is from 3 to 6 months. Scaling or teeth cleaning procedure weakens, loosens the teeth and cause gaps in your teeth. I have seen every patient saying that scaling will always loosen your teeth or it will cause gap in your teeth. This is the most common myth which I see. So this is absolutely false because scaling is a procedure in which you have a artificial, you have a feeling that there is a gap in your teeth. The reason being the tartar or the calculus which was accumulated in your teeth. We are just cleaning that and removing the tartar which is accumulated. So once it is gone, you feel the feeling of a gap being formed. But once the procedure is done, it forms back. The gums, they align it and they form back in position. So it actually doesn't cause a gap or loosen your teeth. In fact, it will make your gums stronger. Gums being the foundation of your tooth, they require scaling procedure every 6 months or maybe once in a year as advised by the dentist. Brushing teeth immediately after eating food is a good habit. Really not, because brushing is a good habit before going to sleep. Because after eating food, again, there is acidic substances still retained in your mouth. If you brush your teeth immediately after a meal, the enamel layer again gets wiped out. So you have to wait at least 30 minutes after eating your food and then brush your teeth. Professional teeth cleaning should be performed every 6 months. So, professional teeth cleaning can be performed 6 monthly, but we will check every 6 months, like whether you require a teeth cleaning procedure or not. If you do not require, we will tell you maybe after another 6 months, like after a year, you can get it done. Using toothpick floss creates gap between teeth. So, using these floss or toothpick is not at all recommended because they actually injure your gums and your tooth tissue. Rather, you can just clean your teeth properly and it doesn't usually cause a gap at all. There are various dental habits which are bad and their impact on oral health is very severe. So, what are the bad dental habits that you need to stop right away? Sipping too many sugary drinks. If you're sipping too many sugary drinks, they can have acid in your tooth and the enamel layer can again erode off. Using teeth as tools. So many people have a habit of opening the cap of a bottle or maybe removing a price tag of a clothing with their tooth or anything. Using your tooth as a tool to do anything is really not recommended. The reason being that, as you can see, when you use the tooth as a tool, it has a high tendency for the tooth to chip or fracture. Okay, so it is advisable not to use your tooth as a tool. Use it for eating and maintaining it. Not brushing before going to bed. Playing sports without a mouth guard. If you're playing sports without a mouth guard, there are high chances that if any trauma you have, so there can be a fracture or anything which can have an impact on your tooth. So it's better you save yourself by putting a mouth guard, save your teeth rather by putting the mouth guard. Tongue piercing. So these tongue piercings are a source of infection, like they can cause bacteria inside your mouth. So highly not a good dental habit recommended. Bedtime bottles. Like mentioned earlier, if you have bedtime bottles, like if you are giving your baby to drink the milk bottle while sleeping, so full time the milk is accumulated inside, which is sugary, and then there is high chances for the cavities to be formed. Munching on potato chips. They are highly rich in starch. So the starch are the sticky things which stick to your tooth. So again, they are very difficult to remove and they can cause cavity. Nail biting. Nail biting also, it causes a chip of your layer of enamel. So not recommended. Smoking. Smoking, as we know, has serious ill effects. It causes bad breath, it causes even oral cancer and many other conditions. So smoking is not recommended. Teeth brushing technique. Now, everyone has a different way to brush their teeth, but do we actually know what is the real brushing technique, the modified bars brushing technique? I'll explain to you the teeth brushing technique. Proper brushing takes minimum 2 minutes. Always make it a habit you practice in front of the mirror. Or if your kids are very bored to brush, you make it a little joyful or playful rather. You can play some music, make them stand in front of the mirror and then practice. Make it a playful activity for the kids and a joyful one. The right way would be using a short, gentle strokes, making a 45-degree angle between your brush and tooth surface. So basically what we do is, imagine this being your tooth, right? And this is the brush. So you have to place this brush bristle at a 45-degree angle, not only on the tooth, but also the gum. Okay? And then you have to push it down like this. Okay? Always start brushing with your back tooth and then you have to bring it front. The logic being you're bringing all the food which is stuck in the front and removing it away. So first you do with the outer surface, then you do with the inner surface, and at last you have to do the chewing surfaces. So this complete procedure should take 2 minutes complete. The type of toothbrush that is recommended would be soft or ultra soft toothbrushes. There are many toothbrushes which are available, medium, hard, but stick to soft and ultra soft. The reason being they do not damage your gums, the soft tissue which is beneath your tooth or beside your tooth. The gums will be protected with the soft or ultra soft bristles, and use a small head. I always tell patients to use a small head because why? The wisdom tooth or the third molar which is there, it doesn't get cleaned if your toothbrush handle is a big one. So use a small head one, but make sure that you're using and cleaning it till right behind. Okay. Halitosis, also known as bad breath. So, what are the basic causes of bad breath, right? Accumulation of plaque or calculus. Plaque calculus is what? It's bacteria. So, bacteria is formed inside and then they start giving a bad breath. Gum diseases. What are gum diseases? Gum diseases is caused because of plaque and calculus. So plaque and calculus goes beneath your gums, get accumulated, and then they loosen your teeth and they cause redness in your teeth. Gum disease is the first sign what you see is your teeth start bleeding. So and also you will have bad breath. So that is one of the cause. If you're having dental caries, like if you're having any cavity, you can have bad breath. If you're having digestion problem, also you can have a bad breath. Dry mouth can also cause bad breath. Oral cancer, smoking, bacteria on the tongue, sinusitis, cold and cough. So all these reasons are the main factors for the bad breath or halitosis, right? Prevention. How do you prevent it? Proper oral hygiene maintenance. And how to treat it now? You have to follow proper diet. If you see there is a change in your diet pattern, you can obviously notice you'll have a bad breath, the first thing. So change and follow proper balanced diet, which is most important. Stop smoking because smoking has many ill effects. So immediately stop smoking. Keeping mouth hydrated. Always keep drinking water and sipping in water because water will eliminate all the extra bacteria and everything and flush out all the unnecessarily food items which are there. Dental treatment. So you can get your cleaning, teeth cleaning and all that done. So your dental treatment will take care of your bad breath. Using tongue scraper to clean teeth. When you have bacteria on your tongue, so start using a tongue scraper. There are many available in the market. Keep it with you and always after brushing, use a tongue scraper so that you don't have any bacteria which can cause the bad breath. Using mouthwash and chewing sugarless gums. So using mouthwash is advisable, but take the advice from the dentist for how much period you have to use. I don't really recommend to use more like full time. If you use for a lot of time, then they can also stay in your tooth. So you can be careful for that and just take a advice from the dentist regarding how much time period do I use my mouthwash. You can also use a chewing sugarless gums. So there are certain chewing gums which are sugarless and they will help to clean all the food which is stuck. Also, the recent study which is found is that chewing gums is effective in also keeping your temporomandibular joint in position. I mean, they give a good exercise to your muscles of mastication here. What is tooth sensitivity? So the causes of tooth sensitivity, you must have seen दांतों में झंझनाहट हो रही है तो उसका what is the reason exactly? Impulsive brushing, like mentioned earlier. Brushing harder means cleaning better. You're brushing vigorously, vigorously, vigorously. Now what happens? It causes three things. In atresion means your tooth is completely becoming flat. It can also cause abfractions, erosions. So, what are these terms? Basically, your tooth layer gets chipped off or worn off. Okay, so not recommended. Cracked tooth. So, like I told earlier, if you're using a tooth as a tool and you're opening a cap, your tooth got cracked. Now, after crack, what will happen? Causes immense sensitivity. Gums recession. Like I mentioned, gums disease. What is gum disease? The bacteria, plaque, calculus goes beneath your gums in the pockets, and then they slowly, the gums become loose from your tooth and they recede down. So your tooth and the gums is here, but the gums will become loose, flabby, form the pocket and they recede down. So that's called a gum recession. Dental decay. So dental decay, the third step, as in when it has reached the dentinal layer of your tooth, which is the second layer, that time you will have tooth sensitivity. Teeth grinding. Many people have habit of teeth grinding, so that can be of multiple reasons: stress, anxiety. Also, if you're having any bite issue, like if your teeth are not properly aligned, they're crowded, you can have tooth sensitivity. How to prevent now tooth sensitivity? Consumption of water after acidic foods. So now you're having Coke, Pepsi, immediately drink a glass of water. Also, what you can do is always drink these acidic foods with a straw. So it causes minimal exposure to your tooth and you can save your tooth. So you can just drink it with a straw and also consume water after having acidic drinks and foods. Do not brush immediately after eating. Do not brush so that it doesn't. Do not brush immediately so that it doesn't erode the enamel layer. Also explained earlier. Carbonated drinks, use of straw with your tooth, and using sugar-free chewing gums. Okay. Treatment of tooth sensitivity. Okay, now we know the causes, we know how to prevent it, but in case it's there, how do we treat it? So, scaling procedure, which is the in which we clean the plaque and the tartar which is accumulated with the ultrasonic tip. This ultrasonic tip with vibrations and water, we will clean it up. Restorations, composite like GIC, all these are the restorative materials which can be filled on your tooth and we can pack it so that you don't have any sensation. Crowns and caps on your tooth, fluoride application, periodontal surgery. 12 signs you should see a dentist. If your teeth are sensitive to hot and cold, gums that are puffy and bleed when they brush or floss can be the sign for the gum disease. You have dental fillings, implants, crowns, dentures. You have got any dental treatment done, so do a regular follow up so that we can see what is going on. Persistent bad breath and bad taste. So, when you have this bad breath issue, you can show the dentist. Pregnancy, definitely. Pain or swelling in mouth, face, and cheek. So this can be reasons for multiple reasons. It can be maybe due to a abscess or an infection in your tooth, or maybe any signs of any oral cancer. We can just show the dentist and they will explain to you if anything is there of that sort. Difficulty in chewing or swallowing. Often having dry mouth. Family history of gum disease or tooth decay. Any medical condition like diabetes, cardiovascular disease. Yes, so the people who are having diabetes, they have to take special utmost care because their gums will be the first sign to show that they have diabetes. So if you're having any issue, you can show your dentist right away. Jaw clicking or pain while opening and closing. When you open or close, if you're having clicking sound, immediately visit your dentist. Source that doesn't look or feel. Okay, so these all are the reasons when you should visit your dentist. Now, did you know that there are certain dental facts which are interesting. Flossing is an essential part of oral hygiene. Flossing once a day can increase your life expectancy by 6 years. And when you don't floss, you are actually missing 40% of your tooth surface. Tooth prints and tongue prints are like fingerprints as they are unique to each person. So we know that fingerprints are different for each individual. Also, tooth prints and tongue prints are also unique to each and every individual. The most hardest substance that you can find in your human body would be your tooth. There are 7 different types of bacteria in your mouth itself. If your tooth gets knocked out, so like if you're playing or if you're fallen with a trauma and your tooth gets knocked out, how what do you do at that point of time, and how do you save your tooth? You can immediately put it in a milk, hold it in your mouth, and the tooth will be surviving longer, and immediately you can visit us so we can put it back into position. But if you fail to do so, then the tooth is lost is all the elements, and then we have to do some other treatment to save your tooth. Milk teeth start to form before you are born, in the embryonic stage. Like in the mother's womb, in the embryonic stage only, the milk tooth is started to form. But it will only appear in the oral cavity once the child is between 0 to 6, from 6 months to 12 months. Okay. Till then it is already present, but only when it's 6 months to 12 months you can actually see it coming out in the oral cavity. Yes, so thank you so much. And I've provided my contact number as well as my email ID and clinic address. If any questions, you can definitely DM me. And even now, you can also post your questions so that we can answer them right away.
So, when someone explains to you something with adding experiences, examples, and demonstration, the impact of that information is very strong on us and it stays in our mind for a very long time. So, thank you, Dr. Angela, for such a beautiful and informative session. There are some questions that our participants have posted. So,
Yeah.
I'll just go through, I'll just read some questions and you can answer them. So, one of the question was, can Listerine be used for bad breath?
Yes, definitely you can use Listerine for bad breath, but you should use it for a limited time frame. Say maybe 1 to 2 weeks at the most, because Listerine also causes staining on your tooth. The stains which are formed. So if the stains are formed again, then you have to go for teeth cleaning procedure like scaling. So I would recommend you can use it, but for a period of 1 to 2 weeks.
Okay, the next question is it advisable to use mouthwash instead of brushing teeth?
Definitely not. Mouthwash is an accessory tool which you can add to have a freshness and everything, and but it doesn't at all replace brushing your teeth, because the brushes actually go to all the nooks and corners of your tooth wherever the flossing definitely sorry, the mouthwash is just a factor which will just act as a liquid to clean it and keep a freshness, but the brush will actually go everywhere and clean the bacteria which is stuck, or the food which is stuck on your tooth rather.
Next question is mouthwash safe to be used for children? So, can children
Mouthwash,
use it?
yeah, they can use mouthwash, but again with a limited time frame, not for a longer time.
The next question is there a time period for changing brush or tongue cleaner? Like, what is the time?
Yeah, so for toothbrush, you have to change it every 3 months, not only when they're frayed, but every 3 months. Also, if you had any history of a respiratory trouble or maybe cold, flu, or you have undergone you had COVID, which is recently going on. So that time you have to immediately change your toothbrush, whether it is frayed or whether it's 3 months or whatever. Just change it right away.
Okay. And the next question is, can tobacco chewing lead to oral cancer?
Definitely. It is the most common thing to cause oral cancer. And India being the capital, you can say, for tobacco chewers. So, on this Oral Health Day, I would really recommend that please stop chewing tobacco or even smoking tobacco. So, it will prevent you from having oral cancer.
Next question was, they're asking if there is a myth whether yellow teeth, yeah, that when the teeth are yellow they are said to be more healthy. So they wanted to know whether if it is true that teeth when they are yellow they are healthy.
No, not really. Yellow teeth doesn't mean they are healthy. It's just a basic thing that you have a color of your tooth yellow. Healthy or healthiness of your tooth depends on how you're maintaining it. If there's no decay and you're taking care of it properly, so it is good. Doesn't mean that you have to have yellow teeth to maintain and look healthy. In fact, people nowadays want whiter teeth. So it's not really that yellow teeth are means that you are healthy teeth.
Our next question was, why do gums become black in color? Is it due to some food?
No, gums are black in color because you have melanin in the gums. There are, you may be seeing that the foreign people, like the US people, they have pink gums. The reason being the melanin content, the melanin pigment is less in their gums. But in Indians, we have more on melanin. So it shows the little blackish hue on your gums. That is natural.
Okay, okay.
You have a
There are
procedure, sorry to interrupt, you
no.
definitely have procedure whereby you can have pink gums. So there's a microabrading burr, so you can polish it and give you pinker gums, so you can visit your dentist for further information. You can definitely have pinker gums if you have thinking you have black gums.
Okay. So there are a couple of people asking your view on the electronic brush instead of using the normal one.
Okay, so electronic brushes, it also it is good, as in you don't have to put any efforts, it will do the normal brushing and everything. But in terms of, if you go to see, like I told you, a normal brush has to be changed every 3 months. So do you really think you're going to change your, and electric toothbrushes are usually costly, so are you really going to follow the same rule, changing it every 3 months? The cost factor also comes into place. And so there are multiple reasons, so I really recommend you stick to a normal toothbrush and use it in a proper way. Electric you can use, no problem, provided you are following the necessary things like changing the toothbrush handle and all that, then you can use, no problem.
Next question is, what is the reason for bleeding of gums and what are the ways to prevent it?
So, bleeding of gums can be due to many things. If you are having bacteria which is accumulated beneath your gums, you will have bleeding gums. So, that is one of the main reasons. The bacteria goes inside, they form pocket in your gums, and the tooth, the gum there are pockets and the bacteria will go inside and sit, and they start to bleed. So, that's the first sign for your gum disease. So, how to prevent it would be you immediately get a teeth cleaning procedure done and maintain it every 6 months. Again, do a checkup and check on your gums. If the gums are healthy, your teeth will be healthy, in short. So, that's the way you can. And also, if they are having bleeding gums after the teeth cleaning procedure, not before, after the teeth cleaning procedure, we will advise you for a mouthwash. So,
Okay.
that will take care of your gum issue.
So there's one question. I think they are trying to ask what can be done for the gap between teeth, whether it is, when there is a gap between your teeth.
So gap can be formed as in a recent gap, or it has been there from before.
The question is not that clear.
Okay.
Yes.
So if you're having gaps in your teeth from the earlier, so the natural way to keep them aligned or bring back to position would be putting braces. So when we put braces with the natural forces, we can align your tooth in a proper position. So that will close your gaps. And also, if you don't want to go for a braces, which is a natural method, there are prosthetic ways by putting caps or veneers which can close the gaps which are there in between your teeth, like that.
So there's one more question. I think that's the last. Is there any after effects on the oral health? So does COVID affect our oral health?
Yeah, COVID effects, as in there is bacteria which can be, usually people have bacteria form on their tongue. So that is one thing which has been noticed after COVID times. Also, there's a lot of general, they are not maintaining the proper hygiene after the COVID thing. So you have to follow the proper dental care hygiene, so that you can take care of your tooth and change your toothbrush every time during after the COVID, so that the bacteria don't keep forming again on your tooth.
Okay, so I think that was the last question.
Okay.
So, thank you so much, Dr. Angela, for sharing with us such important information about how we need to maintain our oral health. As we know, a poor oral health can result in poor overall health. So, thank you for taking some time from your busy schedule for us, and we wish to collaborate with you in future as well. Thank you so much.
Thank you so much.